Good afternoon and welcome to our show. This year, for the annual Pokello HIV testing campaign, we have partnered with Gunhill Medical Facility, and we will be talking to Dr. Tinashe Manyanga. Good afternoon.
Afternoon, Pokello. How are you?
What is HIV and AIDS, and how does HIV affect the body over time?
HIV, basically, it's the name given to the virus that infects the person. It stands for human immunodeficiency virus because of its preference of infecting cells that help our body defend themselves from infections. AIDS is the state that your body gets to when your body's immune defense systems have been destroyed by the HIV virus, so that it's now prone to several infections. So there are certain infections that when we say they are AIDS defining. In other words, they herald that the immune system has been destroyed sufficiently enough. Things like cryptococcal meningitis, for example. It means this person now has advanced immune suppression from the virus.
Besides sexual intercourse, what other ways can HIV be transmitted? For instance, can it be transmitted during foreplay? If there is a road traffic accident, can it be transmitted if you come in contact with someone who's been injured?
HIV transmission happens whenever we have got transmission of certain body fluids, particularly blood, seminal fluid, or the pre-seminal fluid or vaginal secretions. So whenever there is contact with those body fluids, then the risk of transmission is high. Certainly road traffic accidents, if people handle road traffic accident victims without adequate protection like latex gloves, and especially when there are so many things that can potentially cut into your skin. If that HIV infected blood gets in contact with your own exposed body tissue, then yes, you can get transmission of HIV. It can also be transmitted through the sharing of needles. There are people who use intravenous drugs, illicit drugs that is. They tend to share needles because of no access to sterile syringes. They can actually transmit the virus to each other. And it can also happen to us as health professionals during our work, either through a prick, a cut, or splashing of body fluids into your eyes. You can potentially transmit HIV. And yes, if foreplay involves contact with seminal fluid or seminal fluid, then yes, you can also transmit HIV through contact with those body fluids.
Very, very vital information. What are the most effective prevention methods?
The best prevention method is to actually no human interaction. Right. Basically, what we are saying is we want to reduce chances of transmitting these infected body fluids from one person to the other. So when it comes to sexual contact, we would talk about using barrier methods, given that sexual activity is something that human beings have to live for and with. So we can use barrier methods where people can still have sexual intercourse, but there is no exchange of fluid between the two individuals because of the barrier, which it can be latex condoms. We can also talk about what we call now pre-exposure prophylaxis. There are certain medications that you can take before interaction with somebody who is known or unknown to be HIV positive, which can also reduce the risk of actually acquiring the virus, and avoiding the use of intravenous drugs or the sharing of needles. And for everyone in the health profession, preventing needle stick injuries or cuts, those are very effective ways of reducing transmission of HIV.
For the past few years, we've been told about PrEP. What is PrEP, and what are the long-term effects of using PrEP?
So pre-exposure prophylaxis, that's the full term for PrEP. Essentially, as the acronym suggests, we are giving medication before the contact happens. The hope is that we reduce the HIV from actually taking root or establishing itself in the non-infected individual. We want to prevent binding, and if binding happens, we want to prevent the copying of the virus genetic information, and then we also want to prevent the integration of the viral DNA into the host cell's own DNA. We also want to prevent the newly formed viral particles from coming out of the infected cell. The drugs that we use for pre-exposure prophylaxis, they are different. We have got integrase inhibitors, we have got fusion inhibitors. You can actually take them as injectables. We have got a cabotegravir, which is a once every 2-month injection. We have got pills which come in combinations which you have to take on a daily basis. And we also have vaginal rings. These are basically rubberized rings that slowly release antiretroviral drugs to prevent the transmission of the HIV through the vagina, essentially. So all those, they are examples of PrEP.
What are the long-term effects? If I am on PrEP for 5 years, what are the side effects that I should expect?
So the side effects that you tend to suffer from PrEP, they are basically the same as those people who are on full antiretroviral drugs, essentially, because you are taking these drugs frequently. So every drug essentially has got side effects. There is even water has got side effects. There are certain what we call class side effects. There are different classes of drugs, and each class of drugs come with its own side effects. For example, there is a class of drugs that can cause problems to your kidneys, and some of them, they can actually increase the risk of getting fractures to certain areas of your bones. So anyone who is taking PrEP can actually get those same side effects. Some can damage the liver, some can cause problems with damage to the nerves. So all those side effects, they can actually happen where people start complaining of abnormal pins and needles or burning sensation in their hands or feet. So all those, they are side effects that can happen. But what I can hazard to say is people who are on PrEP, they tend to suffer less simply because they are not taking the medication as frequently, and also generally because of advances in terms of drug development. Each generation of drugs is trying to reduce the incidence of side effects, but the bottom line is, yes, side effects do still exist. But one of the things that still remains to be discussed is you are exposing yourself to certain drugs. Over time, we also fear the idea that the virus may become resistant to the drugs that you are taking.
There's been a lot of promotion when it comes to male circumcision.
Right.
Does male circumcision help with contracting the virus?
We need to appreciate that sexual transmission remains one of the biggest contributors to HIV transmission and propagation within the population. So whatever we can do to reduce the risk of men contract the virus, eventually also protects women. If we can prevent one transmission, then we have potentially prevented several other future transmissions. So the way circumcision helps is it removes the foreskin tissue, which we know is very sensitive tissue. It also contains lots of immune cells that the HIV virus likes attacking. So by removing the foreskin, first of all, we are making the male organ hardened so that it's less susceptible to the entry of the virus. And we have also taken away the type of cells that the virus loves infecting. So we are essentially reducing the risk of transmission of HIV to the men.
In a relationship where one partner is HIV positive and the other is not, what are the risks of transmission?
Per every sexual encounter, we calculate the risk of transmission, and the figures say for every encounter, the chances of actually acquiring the virus are around the region of 1.4%, which means you get one HIV transmission for every, is it 75 if my math serves me well, sexual transmissions. If two people have got regular intercourse, the more sexual encounters people have, the more the chance that one of those encounters is going to result in transmission of HIV from the positive partner to the negative partner.
If my HIV positive partner has an undetectable viral load,
Right.
can they transmit the virus to me?
An undetectable viral load, the machines that we use to pick up the presence of the virus, they've got a certain limit. If we say the viral load is not detectable, it means it has fallen below the level that the machine can actually detect them. So the virus may still be present, but it has just fallen below the detection limit, which is still a useful figure. It means there isn't much of it lying around. So having an undetectable viral load is desirable. But just like anything, we can never say there is absolutely no virus within the body. So there can still be enough virus to infect the next person, but definitely the risk or the chances are now significantly lower than somebody with a much higher viral load. The chance, statistically speaking, is never zero.
So undetectable doesn't mean untransmittable.
Yes.
Okay.
But
I think that's one gray area that is when we talk about undetectable viral load.
Yes.
So they still need to practice safe sex, use the PrEP, even if your partner is considered undetectable.
That is absolutely correct, because it has to be multiple layers of protection.
Okay. When is the best time to disclose one's HIV status to a partner?
Wow. Now that one gets me killed. Ethically speaking, it has to be as early as possible, but how early is early and how soon is soon? We hope we have dealt enough with the stigma around HIV to the point that partners feel free to disclose their HIV status the very first time that they know they're HIV positive. But because we still have stigma around, people tend to delay. So my preference as a medical profession is, as soon as you know, tell your partner.
We received a lot of questions on this particular topic. If I am HIV positive, can I give birth to a child who's HIV negative?
Yes, you can give birth to an HIV negative baby. An undetectable viral load for the mother is absolutely essential. And then there are also things that we need to do at the time of delivery, because a lot of transmission happens during the delivery process itself. We normally say that the delivery via the vaginal route carries a higher risk of transmission to the baby than the cesarean section route. And then we also talk about giving post-exposure prophylaxis now, because we are saying the exposure has already happened, and we also would want to give the baby post-exposure prophylaxis so that we reduce the risk of transmission of acquiring HIV, that is. And we also talk about treating opportunistic infections. In other words, we want to make sure that the mother is as healthy as possible, particularly from genital infections, because any open genital wound, it increases the risk of transmission. And certain infections, they also cause a phenomenon where the viral load can actually just spike briefly. Somebody is actually well controlled, they've got an undetectable viral load, and then they acquire a certain infection and their viral load spikes, and then after a short period of time it then comes down. So that spike is what we also want to avoid. So we would want to treat the mother of any opportunistic infections.
How long after exposure should I trust my HIV test result?
In the olden days, we used to talk about the window period of 3 months, because that's how long it takes for you to reliably detect the presence of antibodies to the virus. But over time, we've developed more and more sensitive and specific tests that can detect the presence of the earliest viral particles in the body. So that time has been cut down to as low as 8 days. But in practically speaking, we talk about 14 to 20 days. That's how early we can detect the presence of HIV.
Wow.
Yeah, but we still emphasize the need for serial tests, because we are never dealing with 100%. So the first test can be done as early as 14 days, but you need to continue having serial tests for as long as 3 months.